Once your loved one has chosen an assisted living memory care community or skilled nursing facility, the next critical step before move-in is the community assessment. This is more than just a formality. It's a vital part of making sure your loved one receives the right care, in the right setting, from day one. So, why do communities perform these assessments? Senior living communities are required, ethically and often legally, to ensure they can safely and appropriately meet each resident's care needs. These assessments help confirm appropriate placement, especially between assisted living and memory care. Build a personalized care plan, identify medical, mobility, or cognitive support needs, establish staffing and service expectations, and prevent misunderstandings or gaps in care. Now, when does the assessment happen? Typically, an assessment is scheduled after a deposit is placed or a community is selected, and before move-in day, sometimes just 24 to 72 hours before. It might take place in your loved one's home, at the hospital, rehab center, or even during a visit to the community. At Oasis Senior Advisors Austin in Central Texas, I help coordinate these assessments to make sure they're convenient, timely, and aligned with your family's plans. So, what actually happens during an assessment? A nurse or care team member will usually review health history and medications, evaluate mobility, cognition and communication, discuss preferences, routines, and personality, and coordinate with discharge planners, case managers, or family caregivers. It's not a test, and it's not about judgment. It's about safety, dignity, and peace of mind. If your loved one is moving in after a recent hospital stay or rehab discharge, it's very common for care needs to be temporarily higher than they were before. This can be due to deconditioning from illness, bed rest or surgery, new or adjusted medications, cognitive or emotional impacts from medical events, or just a normal period of transitional decline as the body and mind recover. That's why the assessment is so critical. It helps the community anticipate and respond to current needs, not just historical ones. The goal is to create a care plan that supports recovery, stability, and long-term well-being. Expect some adjustment time. The first few weeks may include physical therapy, new routines, and a little trial and error as care teams and your loved one learn how to work together. That's not a setback. It's just part of the process. A thorough and honest assessment helps set the foundation for a smooth transition into the community, better staff preparation, faster adjustment, and ongoing well-being and happiness for your loved one. If the assessment shows that more services or equipment are needed, like mobility aids, memory support, or more advanced care, that's a good thing to know up front. It means your loved one will be in the best possible environment for their safety, comfort, and peace of mind. At Oasis Senior Advisors Austin in Central Texas, I walk alongside you every step of the way, from exploring options to move-in day and beyond. I'll help you prepare for assessments, answer your questions, and make sure your loved one's needs are clearly communicated. Call me anytime at 512-800-1469 for support, or visit online to learn more about senior living communities across Central Texas.